All right, guys, so the 16-minute cutoff on our video stopped us, so this will be the second piece of the video. So all I did was empty the capsule into the cup here. And you'll get to do that in the lab, so if we miss that, you'll be able to see it. Then all you want to do is add some liquid to it. So you can use the liquid that's in here, you can use the liquid that's in here. Sometimes if it's warm tap water, if you can use tap water where you're working, that will help to dissolve it a little bit more. Usually I just put a little water in there, and then often I'll use the end of the syringe here to kind of stir it around and start to help that kind of dissolving process to take place. Sometimes you have to give this a few minutes to really get it to dissolve. Sometimes I may put the medications in the cup and get them ready while I'm going over and checking my peg tube. Sometimes that might not be the best practice, because if you go over to your peg tube and then it's clogged, it's not working, it's not in the right place, you've now wasted these medications. So, but you'll see it being done either way. So now I have my medications, they're set to dissolve there. I checked my tube for placement and residual already. The other thing I want to do before I administer medications is I want to flush that tube. Usually standard practice is about 30 milliliters that you're going to flush your tube with. So I'm going to pull up about 30. I'm going to get my blue clamp here. I'm going to go over to my tube, open it up, unclamp, and I'm going to very slowly administer that flush. Hopefully I don't meet any resistance, okay? If you do meet some resistance, you're going to gently try to irrigate further. Sometimes the tubes do get clogged and you might have to call the provider and get an order. We usually use some enzymes we can put in the tube to help unclog it. The tube feeding can be very thick, especially sometimes it has a lot of glucose in it, so it gets quite sticky. Some of the medications you're going to give are very thick and sticky as well. So that's why it's really important that we flush very, very good after a tube feed and after we give meds. Make sure that we don't get this tube clogged.
Miss Turner, what's the best way to hold that syringe in place connecting to the tube?
So I always want to make sure that I'm holding it securely, because if you're flushing and this comes apart, you're going to make a big mess. And it will happen, especially if you're meeting a little bit of resistance. So I always grab right a hold here and I handle my syringe both together so that this isn't going to fall out of that area. So now I'm going to go get my medications in the syringe. So all I'm doing is kind of sucking them up in the syringe. The problem with crushing medications and giving them often this route with some water is that you're not going to get all of them. So sometimes what you have to do is you have to kind of suck up what you can get, and then sometimes I add a little bit more water because I still have medication in my cup. Give it a little stir again. Try to get it to dissolve a little bit more. And you just do the best you can. Often there's going to be some little powdery residue in the cup. And you just get as much as you possibly can. Sometimes you're going to do that 2 or 3 times in the cup to make sure that they're getting as much of the medication as you possibly can. Okay? So now I have my medication. I'm going to go back over to my tube here. Hook it up. Unclamp. And again, slowly, holding it very securely, administer your medications. You see I have a whole bunch of air in this syringe too. So I'm not going to give all that air to the patient. I'm just going to give them the medications. I got a little air when I was pulling up the medication. So you can see once your medications go down, and I just have air left there. Clamp it back off. Now I want to get some flush. So I'm going to pull up again about 30 milliliters of water to flush. I want to get those medications down. And again, depending on policy, most often it's 30, but sometimes it might be more. And sometimes if you meet resistance after the medication, you might have to do a little bit more. You want to be careful really with how much you're giving, only in those patients that have some contraindication to fluid. So your CHF patients, your dialysis patients who are on fluid restriction, those are the people you'll want to be really diligent about not giving too much flush, but usually patients will tolerate 30 or 60 without a problem. So I'm going to slowly flush that medication down, reclamp my tube, And now I'm going to document since I just gave medication. So just like with any sort of medication administration, you're going to document after you give them. So now I would date, time, and initial my medications there, and your medication administration piece of it is done. Okay? I want to now talk a little bit about tube feeding. So again, you might have to hook up a tube feed at any time. Sometimes patients, you're going to do bolus feeds, you're going to do continuous feeds. There's all sorts of different feeds you're going to do. Before you do a feed of any sort, you're always going to check residual, check placement, and then you can go ahead with the feed. You might also have to give a flush before the feed if that's what's ordered. So you need to make sure you know what's ordered. Okay? I want to talk you through a couple of different ways in which you can do feeding. The first thing I'm going to show you how to do is a bolus feed just using my syringe. So the order might say something like longevity, 1 can every 3 hours for a total of 4 cans for the day. If I only have to give 1 can, that's usually about 240 milliliters, they should be able to tolerate that going in pretty quickly. It's like a can of soda. How many people can drink a can of soda, about half a bottle of water, and they're not full, they're not throwing up, their stomach tolerates it just fine. So what you want to do is, again, you're going to check your placement, check residual, and then you're going to pull the end right out of the syringe. Get your can, your tube feed, whatever's ordered. Go over to your feeding, clamp it off, put your syringe in. This is going to be a bolus feeding to gravity. So now you can very slowly go ahead and give this person a feeding. You could also flush their tube doing this method too. Sometimes you'll see people, they check their residual, they check placement, they put this on, they dump in a little sterile water as their flush. Now they go ahead and give their feeding. You're going to see how kind of naturally to gravity that formula is just going to go down. So nice and slowly you would do this. Sometimes the recommendation is not to let them get a whole bunch of air, so you're kind of continuously doing this as they tolerate it. And you'll see, as their stomach gets a little bit fuller, that will go a little bit slower, and you'll give the ordered can. Okay? So that's one way to do a bolus feeding. After your feeding, don't forget you're going to do your flush. So again, you would pour that solution, that sterile water, right into the syringe, and just make sure you're giving a good 30 to 60 or whatever policy is, a flush after the feeding. The other way you can do a bolus feeding is using a bag. So you say the order says give 2 cans of Longevity 3 times a day. You would get a bag. How much time has elapsed at the top there?
8 minutes and 9 seconds.
Okay. You got a bag here. Okay, this is actually a bag that's going to work for the pump, but a gravity bag would look exactly the same. It just wouldn't have this piece of it here. It would have a roller clamp on it, just like your IV tubing. So you would actually pour the feeding in, 1 can, 2 can, whatever the order is. You would open your clamp, prime the tubing, get all the air out of it. You would check placement, check residual, flush your feeding tube. You'd hook this up on the pole. You'd open the clamp so that it was running at a fairly steady rate. And you would leave it until it was done. You'd come back 15, 20 minutes later, however fast you were running it. You'd flush the tube and they'd be done with their bolus feeding. So 2 different ways that you can do bolus feeding. The other way that I want to show you is a pump feeding, okay? So you're not going to be tested out on this, but you should be familiar. You should come into the lab and familiarize yourself with it. Play with the pump a little bit. Usually the feeding tube pumps are pretty straightforward, on, off. You select how fast you want it to go. Sometimes you can select a volume that you want to go into the patient. So maybe they want, 1,200 milliliters to go into the patient over 18 hours. Then the pump will actually beep when that feeding is done to alert the nurse that it's done, and they can go in and take it down. Okay, so I'm going to go over to the pump here and I'm going to show you how to do this. You also want to make sure that you label this bag. So you label what kind of formula is in it. There's usually a label right in the bag. So patient's name, room number, the type of feeding they're getting, how fast it's going, how long it's going to go over. And usually when you're running a feeding on a pump, it's going to be what we call a continuous feed. So the rate is going to be something like 50, 80, 100 milliliters per hour, whatever's ordered by the provider. So there's a little door on the side here that opens. Put that part in. This part is very flexible and you can kind of pull on it. You pull that around and stretch it up there. So it goes right around this wheel. This is what's going to actually give the feeding. So you're going to close the door. And this pump is going to prime the tubing. So unlike a gravity feeding where you would actually prime the tubing yourself, this pump is going to do it. So you're going to turn the pump on. And it's going to ask you to keep settings or clear settings. I'm going to clear the settings. I'm going to go, the first thing right here is prime pump. So I'm going to select prime pump and I'm going to select auto prime. You do not want this attached to your patient while you're doing this or they're going to get all of that air. Not that it would kill them or anything, but it just might make their stomach very bloated and uncomfortable. So I'm going to hit auto prime and it's going to auto prime it itself almost all the way to the end. Usually there's a little bit of a gap it leaves at the end. So it's very slowly going to start taking the feeding. And priming it. Like I said, it almost always gets to the end. If you're not happy with how far it primed, you can go to this hold to prime feed and you can hold the button and it will prime it farther. I usually try to get just right to the end there. Okay, so now we're all done. We're going to hit the done button. So we're done with our priming. Now we have to tell the pump what we want it to do. Usually at this point, I'll hook it up to the patient. So again, I'll have checked residual, checked placement, flushed that tubing, and now I'm going to hook it up to the tube. There's a little cap on the end. Again, remember, this isn't a sterile procedure, but we wouldn't want that to like fall and pee or poop or something and then hook it up. We don't want it to fall on the floor and then hook it up to the patient. You're going to be wearing gloves during this procedure because you don't want this tube feed, to get on you, and it often can be a little bit of a messy procedure. So again, it's not sterile, but we don't want to be introducing any microorganisms to the patient that the patient doesn't have. So I go back over to my pump here and I'm going to set it for whatever rate that was ordered. So I'm going to go to adjust feed, feed rate, and I'm just going to hit the buttons. So if you want to adjust the single digits, you hit this. If you want to adjust the second digit, you hit this. So I'm going to put it for like 55 so you can see how I would adjust both of those. Okay, so that's going to be 55 milliliters per hour. Now that feed rate's coming right up there. The other thing that you could do is put in the volume to be delivered. So say the provider ordered for, 300 milliliters, over a few hours. You could potentially do that, figure out a rate, and you could then put in the volume to be delivered 300 milliliters. Because 2 cans is like 480. So it's not like you can just dump 2 cans in there and wait till the bag is empty. You would want to know exactly when that 300 milliliters has been given to your patient. So you can go under, the volume to be delivered and set in there something to be delivered. Usually this is hung on a continuous basis. We just put in the rate and we just keep an eye on it, make sure the bag doesn't get empty. Then the last thing you're going to do is hit run. And it's going to start administering the feeding to the patient. So those are the 3 ways you can give a feeding. You're going to see all sorts of different things, and hopefully at Hillhaven you'll have the experience to really give some feedings. But for test out purposes, you're going to flush the tube, you're going to check for placement, you're going to administer medications through it, and then in lab time you're going to get to spend some time with the pump and being able to actually deliver some feedings. Okay?